Hey, did you know that having bad breath should not be considered normal as we get older? In fact, chronic bad breath in seniors is often a warning sign of a hidden health problem. And, in some cases, this underlying condition can even be life-threatening. In today's video, we are going to uncover 9 breath problems that tend to affect seniors the most. And here's the kicker. Most of these problems don't show up until your body has been trying to tell you something for years. So watch out, because your doctor might not be telling you the whole story. First off, let's talk about the real reason why so many seniors struggle with bad breath. As we age, there are certain changes in our bodies that can contribute to this issue. But when bad breath is persistent and doesn't go away, there's definitely something else going on. Now, if you're noticing that you or a loved one is dealing with this, please don't just ignore it. It could be a sign that there's an underlying health concern that needs attention. The 9th problem on our list is advanced gum disease. This type of gum disease is called periodontitis. Periodontitis is when the gums pull away from the teeth, forming pockets that are super cozy for bacteria to hang out in. Not only does it cause bad breath, but it can also make your teeth feel loose and cause them to fall out. And here's the scary part. Periodontitis can even make its way into your bloodstream and affect other parts of your body. People who have diabetes and other autoimmune disorders are at a higher risk for developing this gum disease. Number 8 is untreated cavities and dental infections. Cavities can be painful, so some people don't take care of them right away. If a cavity gets really bad, it can lead to an infection inside the tooth or even spread to the tooth's root. And guess what? This creates an environment where bacteria thrives and produces bad breath. Root canal treatment and regular checkups with your dentist can keep this problem under control. Problem number 7 is chronic dry mouth. When you don't have enough saliva in your mouth, it can quickly become a breeding ground for bacteria. One of the main reasons seniors get this is because they take medicines that have a side effect of reducing saliva production. Talk to your doctor about switching to another medication that won't leave you with a dry mouth. Also, there are some simple tricks you can try to stimulate saliva production naturally, like chewing sugarless gum or sucking on hard candies. Problem number 6 is gastrointestinal issues or reflux. When stomach acid flows back up into your esophagus, it brings along unpleasant things like bacteria and other digestive juices. These can leave a bad taste in your mouth and contribute to bad breath. If you're dealing with this, it's important to see a gastroenterologist who can help find the right treatment for you. Medications and lifestyle changes can make a big difference in managing these conditions and keeping your breath fresh. Problem number 5 is sinus or tonsil infections. These infections are usually caused by viruses or bacteria and can lead to a buildup of mucus and inflammation in your sinuses or tonsils. As you breathe through your nose, this mucus can get into your throat and create an ideal environment for bacteria to grow. If you're suffering from recurrent infections, consider seeing an ENT specialist who can help diagnose and treat your specific condition. They can also perform procedures to remove any obstructions that might be contributing to bad breath. Problem number 4 is uncontrolled diabetes. People with diabetes produce ketones, which are high levels of acetone in their blood. This means that they have high levels of acetone on their breath. Acetone is a sweet-smelling chemical that gives the breath a fruity odor. When you exhale, some of that acetone goes into your lungs and comes out through your mouth. So, if you're not managing your diabetes well, it could be leaving your breath smelling fruity. To tackle this issue, it's important to work closely with your healthcare team to keep your blood sugar levels in check. With proper management of your diabetes, you can also improve your overall health and prevent any potential complications. Problem number 3 is kidney or liver problems. The liver plays a crucial role in filtering toxins from our blood, so any issues with it can cause bad breath. In advanced cases, it can make your breath smell like ammonia or urine. Similarly, when the kidneys aren't functioning properly, waste products can build up in the blood and eventually end up on your breath. If you notice that your breath smells like a cat's litter box, it could be a sign of kidney problems. These conditions are serious and require medical attention, so don't hesitate to talk to your doctor if you're concerned. Problem number 2 is respiratory issues like bronchitis or chronic sinusitis. When you have these conditions, your airways get inflamed and swollen, making it harder for air to flow in and out of your lungs. This means that the air you do manage to breathe in has to work twice as hard to get through those narrowed airways. And as a result, more bacteria ends up hanging out in your mouth and lungs. Eventually, that bacteria can make its way onto your breath and cause bad breath. So if you're struggling with breathing or have a chronic cough, consider talking to your doctor about ways to improve your lung health and tackle that bad breath problem. Problem number 1 is ill-fitting or poorly cleaned dentures. Dentures can be a great solution for people who have lost teeth, but they need to be taken care of properly. If they don't fit well or aren't cleaned regularly, they can easily become a source of bad breath. Poorly fitting dentures can cause food to get trapped underneath, leading to bacterial growth and bad breath. On the other hand, if dentures aren't cleaned regularly, they can accumulate plaque and tartar, which can also cause bad breath. If you wear dentures, it's essential to see your dentist regularly for checkups and to make sure your dentures are clean and well-fitted. With proper care, dentures can help you maintain good oral health and fresh breath. Now, you might be thinking, "Doctor, why are you focusing on my breath? What does it have to do with my overall health?" Well, here's the thing. Bad breath is kind of like your body's alarm system. It's trying to tell you that something isn't quite right. So when we look into your mouth and examine your breath, we are essentially checking in on your body to see if everything is working properly. By doing so, we can catch potential problems early on and address them promptly, which can make all the difference in your treatment. If you're a senior or you're caring for a senior, it's important to pay attention to the signs of these 9 breath problems. Untreated, they can not only affect your oral health, but also cause discomfort and social anxiety. Imagine going to an important event and being so worried about your bad breath that you can't enjoy yourself. Social anxiety caused by bad breath can have a significant impact on a senior's life. They might start avoiding social gatherings, which can lead to isolation and depression. And this problem can be even more challenging for seniors who already face social and physical limitations. Bad breath can also affect a senior's self-esteem and overall quality of life. It can make them feel self-conscious and embarrassed, leading to decreased confidence and a negative self-image. Seniors might start hiding their smile or covering their mouth while talking, which can impact their communication skills and ability to form relationships. If left untreated, these issues can worsen over time, leading to further social and psychological problems. Now, you might be wondering why doctors don't always seem to care about solving your bad breath problem. Well, here's the thing. Many healthcare professionals don't receive adequate training in diagnosing and treating the underlying causes of bad breath, so they might not be aware of the various health conditions that can cause this problem. Additionally, doctors often focus on treating specific illnesses or injuries rather than taking a holistic approach to patient care. This means that they might not consider bad breath as a symptom of a larger issue. And if you're a senior, it can be even more challenging to get your doctor to take your bad breath concerns seriously. This is because many healthcare systems prioritize treating acute or life-threatening conditions. So, chronic issues like bad breath might not get the attention you deserve. It can be tough to figure out whether your bad breath is coming from your mouth or from somewhere else in your body. Here are a couple of simple tests you can do to help you discover the origin of your bad breath. First, you can try putting a small amount of water or milk onto a cotton swab and gently rubbing it along the back of your tongue. If the liquid starts to smell bad after you rub your tongue, then the problem is likely originating in your mouth. Another test you can try is the coffee breath test. After drinking a cup of coffee, wait 10 to 15 minutes and then take a deep breath. If you can smell coffee on your breath, then it's likely that your problem is coming from your lungs or sinuses. If you've tried these tests and your bad breath still persists, It's time to schedule a visit with your doctor or dentist. But here's something really important to remember. Make sure you communicate all of your symptoms to both your dentist and doctor. Don't assume that they already know about your bad breath or other health concerns. By sharing all of your symptoms, you'll help them better understand your situation and provide better care. One way to begin tackling this problem is to develop a good oral hygiene routine. This includes brushing your teeth twice a day, flossing daily, and visiting your dentist regularly for checkups and professional cleanings. Good oral hygiene can help eliminate bacteria in your mouth and reduce the likelihood of oral issues that contribute to bad breath. However, it's important to remember that bad breath can sometimes be a symptom of a more serious underlying health problem. So don't rely on oral hygiene alone to solve the issue. If you're still experiencing bad breath after taking care of your teeth and gums, it's time to talk to your doctor and see if there's an underlying condition that needs attention. All right, now let's talk about a little myth. Some people believe that bad breath is just a natural part of getting older. Well, let me tell you, that's simply not true. Just because we get older doesn't mean we should just accept bad breath as a given. In fact, studies have shown that people of all ages can experience bad breath. So no matter how old you are, if you're dealing with bad breath, there's probably an underlying cause that needs to be addressed. Think of your breath as a metaphor for an iceberg. What you see on the surface is just the tip, but there's a lot more going on beneath the surface. That's exactly what's happening with bad breath. It's the part of the iceberg that's visible to us, but it's not the whole story. To truly understand what's causing bad breath, we need to dive deeper, much like exploring the vast ocean depths to uncover the hidden secrets of the iceberg. We need to investigate the underlying causes and connections to other parts of the body. And that's exactly what we do as healthcare professionals. We connect the dots between your bad breath and other potential health concerns, guiding you towards a better understanding of your overall well-being. I want you to think of a situation where someone went to their doctor complaining of bad breath. The doctor performed a few tests and was unable to find a specific cause for it. However, during the examination, the doctor noticed a small lump in the patient's neck, which turned out to be a sign of an underlying health problem. This serves as a reminder that sometimes our symptoms don't always lead us directly to a diagnosis. Instead, they might point us towards an entirely different health concern that requires attention. Therefore, it's crucial for both patients and doctors to be observant and explore all possible connections between symptoms and underlying conditions. By the way, if you found this video helpful, please hit that thumbs up button below and subscribe for more informative content. And now I want to hear from you. Do you or a loved one deal with chronic bad breath? Did you know that it could be a sign of a bigger health problem? Share your thoughts and experiences in the comments below. Thank you for watching. Until next time, stay healthy and curious.